My name is Bridget Watson-Favre. I'm a nurse practitioner consultant for Cannabbis Supply Company.
Like many healthcare professionals now treating patients with medicinal cannabis, Bridget was first a patient herself, as she had been diagnosed previously with multiple sclerosis.
I came to look into cannabis because I myself am a medical cannabis user. I have multiple sclerosis, and I have found that cannabis has done wonders for my symptoms and my symptom management. I really wanted to see that other patients could have access to it in a much easier way than I had to find access.
Sue Milbury is one of Bridget's patients. She was diagnosed with thyroid cancer in 2013. Her related surgeries and treatments left her struggling with debilitating side effects.
It affected my sleep. It was horrible. The first 2 years of my after that were awful. Horrible anxiety. I didn't even want to go back to work. Even when I went back to work, my boss even said, "You're shaking all the time." And it got worse. The doctor prescribed Percocet for pain. And the side effects from that, I only took a couple, but the side effects were awful. They made me sick to my stomach.
A friend had talked to Sue about medicinal cannabis.
And I tried it, and it helped so much that my husband did some research. And I went to my family doctor and requested prescribed cannabis.
At that time, Sue's doctor did not feel comfortable prescribing cannabis.
I was on way too many medications as it was. The side effects were awful. So my husband found Cannabbis Supply Company. And we came in, and I met with the medical specialist, and they set up the appointment for me, and that was how I first got my prescription.
Medicinal cannabis is a very patient-specific tailored medication requiring patients to become educated on the variations, strains, and methods of ingestion. The patient and healthcare professional relationship is ongoing and key to best outcome.
Medicinal cannabis is a medication, so you have to treat it like a medication. You get a lot of education with medicinal cannabis. You're going to see higher ratios in the rec market of THC or tetrahydrocannabinol, whereas in medicinal you're going to see higher ratios of the opposite, which is the cannabidiols or the CBD.
Medicinal cannabis is not about smoking marijuana or getting high. Still, the stigma surrounding cannabis can make patients feel uncomfortable.
I was nervous coming in here. I was really nervous, but we met with the educator, and she was amazing, explained it all to me, how it would help, that I didn't have to smoke. And the doctor that I met with when I had the meeting on the telehealth, she explained it all to me and told me to get a vaporizer and to use the vaporizer and the oil.
Cannabbis Supply provides education about the uses of medicinal cannabis and the different options for its intake, whether it be vaporizers or other forms of ingestion. They are happy to greet and serve patients through their storefront locations, offering telemedicine appointments on-site or remotely with the clinic's physician educator and/or nurse practitioner.
A couple studies out there that have actually shown that patients will open up more in a telemedicine communication because they're in their own physical environment and they feel much more open and comfortable.
Doing the telehealth, being face-to-face with the doctor, I found it a little bit easier to deal with than face-to-face with the doctor because it was very casual, very professional. I felt I could ask questions, especially because with Bridget, it didn't feel like I was in a doctor's office.
Every day I leave work feeling great that it has helped so many patients and knowing that, I have gained success from it and it helps me every day, and to see it's life-changing, it's a game changer. They never knew they could have such success with it. You leave work feeling so positive.
My quality of life is 100% different. Even before the thyroid issues, the sleep issues I had, I was on 2 different medications for sleep. I don't take any of those anymore. I don't take anxiety medication anymore. I don't take blood pressure medication anymore. All gone. I've learned so much about this plant, it amazes me.
To learn more about medicinal cannabis, speak with your doctor or contact the clinic directly.